Hello, everybody. Welcome to the Mission Employable podcast. My name is Ryan West. I am your host. Today's show is awesome. I was telling the guest before we hit record that we've been trying to get somebody on from this entity that is Unity Point for basically since we started this. We're at episode 125 this morning. That's the last episode that came out. We're recording on video, so if you're watching this on our YouTube channel, thank you for checking this out. Thank you to our guests for coming on video. That's something we're doing more of. Today's show is all about Unity Point Health. I think specifically we're talking about Des Moines and what they're doing around some innovative registered apprenticeship opportunities to fill positions that are so desperately needed in the state of Iowa. And I cannot tell you how much we hear about healthcare in this building alone, the Iowa Workforce Development Building. We'll talk about that. Unity Point Health offers employees opportunities to grow within their career. Apprenticeships offer structured training programs which provide employees a chance to work toward furthering their career. I stole that right from the website, which I normally do. Joining me on the microphone to talk all things Unity Point employment is Natalie McNaught, who is a retention specialist. And you're going to hear she's got a wealth of information with Unity Point. Thank you for joining us and welcome to the Mission Employable podcast.
Thank you for having me. This is exciting.
Absolutely. And I'm not kidding. We really I have wanted to get somebody on from Unity Point in the healthcare field alone. And then actually, it's funny, you're the kickoff to some other healthcares now that the floodgates are open now. So it's great to have you guys on. I cannot stress enough how many times we see healthcare at the top of every list that we have for vacancies. It's really crazy. You know, what we try to do is kick off every interview just to get people in the feel of things, what's going on. No different here. High-level overview of what your role is. We were talking a little bit before we hit record. You've got some great background. And what do you think the biggest challenge is? We're going to hit you with one right off the bat. What do you think the biggest challenge is in healthcare hiring and your time in this role? So a lot there, but unpack some of that for us.
So, I work as the retention specialist with Unity Point Health Des Moines. I've been in that role for 2 years now, but with the organization for 22 years.
So some great time there.
Yes. And I currently work with our entry-level team members on programs to not only help them keep their jobs, but then on programs to help them move up into positions that have more sustainable wages.
Yep.
I also create and maintain programs with our community-based organizations
in
the area, and that leads to applicants in those entry-level positions that may be vacated by those who are moving up into positions.
Right. Which I think gets lost in all this. You know, it's not we're trying to hire people, we're also trying to move people up the chain, and that kind of gets lost. And so I don't mean to interrupt you.
No,
that's a great point.
Yep. So some of the main things I do is I work with our apprenticeship programs, which we're going to talk about, and youth internships. So we just had a great couple of youth internship programs. We got a grant from Future Ready Iowa to have some of our own interns. We worked with the Evelyn K. Davis Center and Oak Ridge to have some interns for them.
For sure.
I also work one-on-one with our current team members. We do things like resume writing, interview skills, things like that. And then we have a breakthrough leadership program that I run as well, and that's for people who are ready to be in a leadership program in maybe 1 to 3 years, but kind of need to work on some of those skills. The biggest challenge
right off the bat, first question.
The hardest question, I would say the biggest challenge is probably what's going on right now. I've never seen anything like it, and it's the competition for talent. And it's not only us and that we have so many positions, but it's everywhere. Everybody is feeling it, and everybody is trying to figure out and scramble, how do we get people in the door? How do we keep who we have? Things like that.
Well said. Let me ask you a question. First of all, thank you for answering that question. So see, we've just ripped the Band-Aid off right there. So everything's home from here. Do you think in your role, you've got such a great background, you got a real good foundation in human resources. Do you think, especially an entity your guys' size, that if you're going to move into a role where you're doing retention and hiring, don't you think it helps to have that HR background as well? I mean, because sometimes I feel like the HR folks, and I'm not picking on employers, this is just what they got to work with. You can't do everything when you're in HR. I do think there's a separation there. What do you think there? I mean, you've done both now. What are your too much? Is there a lot of overlap, or you work hand in hand? How does that go?
I think we'll start with, when people think of HR, they get scared. HR is there to to help its employees and bridge the gap between employees and leadership. And there are all sorts of different positions. And I've been in the front office, I've been in recruiting for 13 years, and now in this role.
Yeah.
And I think people need to know that we're there to help,
Sure.
especially in my role.
Sure.
And it helps, kind of like you said, that I have all that. I've been with the organization
Yep.
for so long. I know a lot of the positions that are there, and
Yep.
I can help people identify their career pathways
Yep.
and what they need to do to get to where they want to be.
Yeah, I agree with you. I mean, I've had experience in understanding what every kind of corner of the organization is so helpful. My point is, I think too, you kind of triggered something there for me. I think sometimes employers could look at folks they have who haven't traditionally been in a role to go out and find talent, could probably do it just based on their knowledge of what they know of the organization. And so thinking out of that box. So it's a good thing. I've really beat that question down here a little bit. So let's go to the next one here. I just am, I'm fascinated by what your background is in healthcare. If you're not familiar, healthcare jobs in Iowa have consistently been number one regarding most vacancies in the state. And that was even before the pandemic.
Yeah.
The pandemic just kind of ripped it off so everybody sees it. With that said, Natalie, talk to us about when, how, and why Unity Point Health started to implant that registered apprenticeship model. And, we're hearing more and more about it all the time into fields that, I got to say this, I sound like a broken record, but just aren't the trades. Talk to us how you started or wanted to finally go down that route of implementing that RA format.
Yeah. I think the person who had the position before me really started to get a lot of information about apprenticeship programs. So I think about 3 years ago is when we started our first one, which was our Certified Medical Assistant program. It was recognized as a position that was very high demand in our clinics, and I think the enrollment in the school programs was low as well. So what do you do? And we learned about apprenticeship programs, that they're obviously a way for participants to earn while they learn. They get free education toward a trade or a certification. They get to earn money while they're working, doing their on-the-job training. And we also found out there's grant dollars available to run these programs and start them, which helps a ton.
Yeah.
And so, like I said, the Certified Medical Assistant was our first one. And then so how we did it, we had lots of conversations with our leadership, had to learn about really what the position does, what is your need, and then go to and have conversations with education partners, like DMAC is a big one for us, and learn about how the program is ran, what classes do they need to take, what supplies are needed, books, what's the costs of the program. So we gather all of that information, and then we go to the Department of Labor and say, hey, we want to start this program, and then we work with them to get it all registered, and then we get it started.
Yeah, and so, with that certified management one, and we're going to talk a little bit, I guess, real quick to preface this, about some of the specific programs you guys have out there. We're getting into the weeds of it. That certified management one, that just became the topic, the hot button for you guys, because you just couldn't fill the position and there was a desperate need for it.
Correct.
I don't mean to ask, this kind of maybe sounds like a no-brainer question, but that is familiar to a lot of folks out there, no matter what industry.
Yes.
And what do you think the decline in that role was? Was it just because folks just weren't engaged in it anymore?
It could be that. It also could be that maybe people don't know about that position.
Right.
Because, so what a certified medical assistant is, it's those people that you see when you go to the doctor's office.
Yeah.
They're the nurses taking your vitals, gathering all that information for the doctor. And maybe somebody didn't know what it was called.
Yeah.
Or, doesn't know about it. So it's a good thing to get the word out about the different positions.
Well, and so that leads right into the next question I was going to ask you, which is it's kind of about the marketing it too. Sometimes I think when folks engage in the registered apprenticeship format, they figure out a way to market in a way they haven't been doing before, couldn't do before, or just didn't want to do before. And, it's a perfect segue to do all of those things. And, oh, by the way, the person you're bringing on is going to get a great opportunity to have low debt and stay with the company.
Yep.
Okay, are you guys using the model to not only bring on new talent, but also upskill that current talent then too? You kind of touched on this a little bit in your opening remarks. Talk to us about how you maybe I'm going to screw up the acronyms, forgive me, but how an LN can go to RN, or how can you move up the rung there?
Yep. So I work a lot, like I said, with our current team members. I will do, my manager and I have called it the Natalie Road Show.
Right.
I go visit our different departments, maybe their team huddles or their team meetings.
Yeah.
I talk about what I do and what services I can bring to them to help them identify career pathways or different positions in the organization. And one of those things that we talk about, obviously, is the apprenticeship programs.
Yep.
And from those, I have had team members call me and say, hey, I'm interested in learning what a patient care tech or a nurse aide does. Can
Yeah.
you talk to me about that? And I can, since they're already employees, it's so easy for them to be able to go do a job shadow and, be like, is this really something that I want to do? Or, we've had people maybe do a job shadow of a surgery before. Well, then they pass out. Well, that's probably not the right
Right. Now
field
you know.
for them to go into. So let's think of something else for you to go into.
For sure. Yeah. Yeah. No, that's a good point. And I wonder can you touch on, is the engagement, and when you're doing that, is it growing, or is it just a constantly push? You just kind of got it. It's one of those things that people got to hear a few different times, because I think sometimes people get into an organization and they think they're happy with where they are. Little do they know there's a whole nother opportunity for them. And you also said something I think is key. They're already in the organization, so they've cleared a huge hurdle right there. What do you think the engagement's been in the last 12 months or so?
I think it when I put it in front of them, then I get the influx of people coming in. And then I think, it they forget about it until maybe 6 months later I go back and then it, influxes again.
Upticks.
So I think, you just have to keep engaging people and letting them know, like, hey, I'm here. These opportunities are here.
Yeah. Yeah, I think it really comes back to the marketing piece of it too, and keeping those folks engaged. Okay. So now let's get into a little bit of the weeds of some of those specific programs you guys offer. And you talked about them a little bit. Give us the scoop on the programs. And I selfishly took this right from the website. You guys got some great stuff. And let's plug the website real quick, by the way. We try to do that in every episode. So, you guys have a great setup where you can just type in Unity Point Registered Apprenticeship, and it's going to bring up a great page. And if there's a different one, please tell us. But on that page right there, there's a lot of good information. You guys got to have a quick YouTube video as well about your Registered Apprenticeship. And then it breaks down. And by the way, you also got the Earn and Learn logo out there. So thank you. That's part of Iowa Workforce Development. But then you got these three main programs that are out there. You have the Medical Lab Technician Apprenticeship program. You have the Patient Care Tech Apprenticeship program, and then you have the Registered Nurse Residency Apprenticeship program. Mouthful there, but talk to us what those are.
Okay. And we also have a facilities engineer one.
Okay, cool.
That I had to pull it down because we're doing some rework on it, so
cool.
that will be out there too. So I'll talk about that one too.
Yep.
So I've kind of touched on the certified medical assistant, and
is that one listed out there too, or is that listed?
I think they're working on that one. As well.
Because you guys got more than three. That's the bottom line.
Yep,
okay.
We have 5 total.
Okay.
And so I explained what that certified medical assistant does, but it is a 2-year program, and they work towards that certification for the medical assistant position. And usually it's for current team members, and they must be in a position at least 6 months.
Okay.
And while they're in the apprenticeship program, they're working in a position called an experience specialist.
Yeah.
And those are the ones that work at the front desk in the doctor's office.
So on this one's a great point. So if you're just trying to get your foot in the door, it's another great opportunity. I almost wonder too, it's like if you can get a 6 month to a year just feel of the land of the organization and then move into it, that's not a bad concept either.
Yep.
Okay.
Yep.
All right.
The medical lab tech one, those are the people that perform the tests on when you go get your blood drawn at the doctor in the hospital. They perform tests on anything pretty much that comes out of the body.
Sure.
That's for current team members as well, and they usually work in the lab support tech position. Again, a front office position. They're answering phones, maybe doing some blood draws, things like that.
How long is that program?
That one's 3 years.
That one's 3 years. Okay, for this one then, what type of, do you need a degree to get into this program then?
No.
Okay, just so that's a key thing too, because I think sometimes people get confused on that. It's a registered apprenticeship, high school degree, and you're off and running.
Correct.
Okay, as long as you meet the other requirements of being within the organization. Okay, great. Okay, awesome.
And the next one is patient care tech. That's what we call our nurse assistants, certified nurse assistants. And they assist patients with their activities of daily living, like bathing, feeding, dressing, things like that.
Yeah.
This one is for current and external people
Okay.
to apply for.
Okay.
We try to have 3 cohorts per year, January, June, and we just hired for our September one. So I'll be
Awesome.
looking for that again
Yeah.
in January.
Okay.
It's a year-long program, and they get both their basic and their advanced nurse aid
Wow.
during that year. Yep.
Okay, and that one. So real quick on that. So if for the next one, if folks have questions, where do we want to send them to get information? We're out on the website. Just go to type in Unity Point Registered Apprenticeship. It's probably the easiest way.
Exactly.
Okay, and that one. What do you think makes a good candidate for those roles? Just somebody who's engaged with health. I mean, because if external, you may not have any healthcare background. What do you? Sorry, I'm totally putting you on the spot with this question, but what do you think? For folks that are out there listening, well, what does a normal person think on that?
Somebody who's very compassionate.
Yeah.
You have to be in healthcare who really wants to help people and understand that, you're seeing people at their worst
Sure.
when they're in the
Sure.
hospital. So
Yep.
just kind of understanding that and wanting to help them get better.
Yeah.
And go home.
Okay, fair enough. Okay, sorry, third one.
No, that's okay. The facilities engineer, so that's a 4-year program, and our engineers work on everything that kind of makes the hospital run.
Yeah.
HVAC, plumbing,
Yeah.
chillers, boilers, things that I did not even know existed until I started in
For
this
sure.
position
Yeah.
and had to learn about it. And then
How long is that program?
4 years.
4 years.
And they are working towards getting their first class engineer license.
Wow, very
Yep.
cool.
Yep.
What's the pay on that? Is it? Can you find it out there if it's listed? I don't mean to put you on the
No,
spot with
that's
that question.
I don't know off the top of my head.
Yeah.
But yeah, they can always give me a call or
Okay.
email me.
Okay, we'll talk about context at
Yep,
the end. Okay,
yep.
that's an interesting position as
Yeah,
well.
yeah. And yeah, because people usually think of nurses and doctors
exactly.
when they think of the hospital.
That's
So,
exactly
yep.
right.
And then the last one is the registered nurse.
Okay.
It's a residency program for nurses who have less than 6 months of experience. And we got it as a registered apprenticeship program a couple years ago, which is fantastic.
For sure.
It's a year long, and it's to help train new nurses kind of transition into that full patient load.
Yep.
And they do it by peer support, and then our residency coordinator also puts on like seminars that they go to throughout the year.
Yeah.
And there's a project that they have to do
Yeah.
at the end of that. So it's a very nice way to help them transition into, you graduated from school, we're not going to stick you with, 24 patients all at once, but we'll gradually transition you into your nursing practice.
Yeah, that's awesome. Boy, so you guys got 5.
Yes.
I like how you have. It's not just healthcare. I mean, it takes people to run the show there too. The building and where do you think you're going to go in the future? You think you'll add more down the row if you can, or?
I think we're always evaluating our high need positions.
Yeah.
And, you have to check with the Department of Labor first to see if they have that as a registered apprenticeship.
Mm-hmm.
And then, again, evaluate all the costs, what's needed for classes, how long the program's going to be, because you want to make it reasonable for people as well. So I think we're always looking at expanding.
Yeah, and how do we get more diversity into these roles and more males too? Because I think that's probably a common thought process. Well, you have to be a female to be, which isn't the case, obviously.
Right.
So, and I know those are tough things, because you're. If you're not interested, you're not interested. But, the diversity, so how do we get more folks engaged in that? Or what are you trying to do for that is maybe a better way to ask that, because I know you guys are.
Yeah. So, again, it's our partnerships with our community-based organizations.
Sure.
We're looking at ways to work with the immigrant and refugee population more. There's lots of opportunities for them as more come into the country.
Yeah.
And I think it's important for people, again, like I said, like healthcare is not just nurses or doctors. There's all these different careers.
Yep.
And, like we talked about the facilities, there's therapies, there's surgical tech, there's respiratory care. So I think if people maybe shift their mind and think of it that way, like there are so many ways. And if people don't want to be in a patient-facing position,
right?
We have, like I said, human resources. We have a marketing department. There's accounting.
Yep.
There is all sorts of different fields in healthcare for people to
Yeah.
get into.
And what do you guys do to, do you go out to high schools and to try to get them engaged? Can you talk about that too,
Yeah.
and how that process works?
Yep. So our recruitment team is always looking for career fairs
Mm-hmm.
to go to. And, places will reach out to us and say, hey, we're having one, next month, can you come? Or if we haven't heard from somebody in a while, we'll say, hey, I know you guys had a career fair last year. Are you doing it again? We'd like to, keep in contact. We're always having schools reach out to us like, hey, can somebody come talk to us? Or, you want to be involved in this program? We're just, it's good to network, meet people, opportunities.
Yeah.
Like that.
So so let's say somebody's listening, and I'm just pick a town, Sioux City, Shenandoah, for example, right. And they're like, well, I'm not in Des Moines. You got more locations, obviously, than just Des Moines. How does that part of it work then? So meaning, do you have to be in Des Moines for some of these? Where do you need to be to participate in some of this stuff?
Yep. So the apprenticeships that I talked about are just in the Des Moines affiliate now, hoping to expand to our different affiliates.
Yep.
And so that would be, if somebody from Sioux City happened to contact our office, we would connect them with their, because each affiliate has their HR department.
Gotcha.
Yep.
Okay.
So we would connect them with their resources.
Gotcha.
In their area.
Okay. But you're always welcome to move to Des Moines and check one of these positions out as well. Yeah, or vice versa. So great stuff. Okay. Lastly, I've asked you a lot of questions here. Thank you for all your help.
Yeah.
Lastly, what do you think, what would be your number one goal in your role over the next 5 years? If you had a wish list, like, I really want this one thing, what do you think that would be?
Oh, wow. Really putting me on the spot.
Yeah, totally. Yeah, let's close it out on the spot too.
I think I just want to help as many people identify their passion as I can.
Yeah.
I can't put a number on that,
Yeah.
but, a really great example, I have two examples, is I just worked with a housekeeper a couple months ago, and she'd been in the role 13 years and enjoyed it, but just wanted to do something else and wanted to be
at Unity Point.
Yes, connected with people more. And she thought about the patient access or patient registration. And so I set her up with a job shadow there. Nope, wasn't for her. We went to food service. We have a host position that is actually on the patient floors and takes food orders from the patients and then delivers the trays to them. Loved it. She applied for the position, got it, got a day shift, and got a raise. And it was just awesome to hear the joy in her voice. Sure. I had a food service person who got into the patient care tech apprenticeship program a year ago, and so she just finished in June. Yeah. And she wrote a little testimony for us about her experience. Yeah. And she had pictures included that had her with her certification. And
very cool.
Just like things like that. I want to be able to have more of those successes.
Well, I think we lose track of. Thank you for sharing that. First of all, I think we lose track of, how important, impactful these things are for people. We think career, but really it's impactful on people's lives too. Yes. And so great stuff. I can't thank you enough for making time, and thank you for what Unity Point has been able to do through the last couple of years. I know it's been tough on everybody. We really appreciate your time. Thank you for mentioning Future Ready Iowa as well. That's great to hear. Folks, you have been listening to Natalie McNaught, who is the retention specialist with Unity Point. You can find out more. I'm just going to go check out unitypoint.org. But there's a lot of information out there. You really do have a great registered apprenticeship page. Thank you for making time. I really appreciate it.
Yeah, this is awesome.